Let me first of all introduce Lois Wales. Lois Wales, in the fall of 2010, became the first woman elected as president of the Manitoba Government and General Employees Union. For over 20 years prior to this, Lois held a variety of high-level leadership positions in the union while working as a cardiologist, technologist in Selkirk, Manitoba. And I want to say that I've known Lois for a number of years. Her and I set up the Child Care Coalition in Manitoba, which is still ongoing. Lois was MGEU's fourth vice president in 1996, when nearly 3,000 home care workers went on a months-long and ultimately successful strike to prevent the privatization of Manitoba's home care program. And from 1998 to 2010, she served as the MGEU's first vice president and chaired the Constitution, Bylaws, and Structure Committee, which brought about the union's clear language constitution. Today, Lois serves on the executive of both the Manitoba Federation of Labor and the National Union of Public and General Employees, NOTCHI, and she's working closely with MGEU staff, home care activists, and the regional health authorities to create equivalent full-time positions within the province's public home care system. Please join with me to welcome Lois Wales.
It's a great pleasure to be here tonight to speak to retired union activists. Many of the things that we enjoy in our unions today was hard fought by you, and it's a privilege for me to speak to you tonight. I'm here to speak on the Manitoba experience, and one of the great things about being a Manitoban is that we were the first province in Canada to institute a public home care system. But I'm not really going to talk about that today. Instead, I'm going to tell you about how very hard we have had to work to keep it public, and how hard we continue to work to improve the system and the working conditions of those who deliver this vital service. The public home care system was started by the Ed Schreyer NDP government way back in the 1970s as an alternative to treating the chronically ill or disabled in institutional settings. The home care workers were considered a casual workforce, but by 1998, the MGU had organized home care attendants, and they did have a contract, albeit not a great one, with the employer. Still, from a service delivery perspective, the program was groundbreaking. A 1998 Price Waterhouse review of the program said it was the model for North America, and two University of Minnesota professors in healthcare wrote, "Manitoba illustrates one of the best long-term care systems in North America." And yet, by the mid-1990s, the Filmon Tories in Manitoba were at the height of their power, and the right-wing policies that continue to plague us to this very day were coming into their own. A leaked Treasury Board document outlined their plan. The work done by 3,000 home care attendants, home support workers, and home care nurses would be contracted out to the private healthcare companies. They claimed that private bidding would give the people of Manitoba the best price for the most efficient service. After all, how could the market ever lead them astray? Home care workers were shocked to discover that their jobs would not be guaranteed when the program was switched to private sector. They'd simply have to apply with the private companies at a $5 hour per less salary. And because they were considered casual employees, most did not even qualify for employment insurance. In essence, they were a scattered, poorly paid group of people, the majority women, many of them recent immigrants. And the Tories thought that they would just disappear. And frankly, the union was not entirely prepared for the full frontal attack of privatization. There was nothing in the home care agreement that prevented the government from privatizing the service. And frankly, as MGU leaders, I myself, as fourth vice president at the time, and I think let me see, I was 20, I'm 29 now, so I must have been really, really young then. We had absolutely no idea how home care workers would respond. While we'd won them some improvements in their contract over the first two agreements, they remained isolated from each other just by the very nature of their jobs. Few turned up to local meetings. Well, privatization changed all of that. Many had experience working with some of the private companies. One worker expressed it this way: you couldn't get stable hours, and every week you had different clients. Every time you went to a new house, it took time to adjust to your conditions and to get to know each other. By mid-March of 1996, turnouts for meetings were huge. Many workers had clients who encouraged them to fight. As one worker put it, this strike is for the right reasons. All we want is job security and keep the quality of care that our clients have now. Without question, the home care strike of '96 was a historic highlight of our union. I was at the legislature early one morning when hundreds upon hundreds of home care workers came carrying homemade signs, many crying at the sight of such solidarity. By the end of the week, we had home care picket lines up and running all across the province. But vocal and organized public support was crucial to our fight. Public home care supporters, including hundreds of clients and their families, created the Coalition to Save Home Care that drew 25,000 people to a rally at the legislature. By the strike's end, 12,000 Manitoba families had placed "We Support Home Care" signs in their lawns. By the strike's third week, the government blinked. They agreed to no layoffs, and we agreed to the right to contract out 20% of an expanded service in Winnipeg only. And as of today, there is very few contracting out to private companies. But at the end of the day, the victory for the public system was total and complete. The MGU relentlessly kept up public pressure on the government. The American company that the Tories had signed up for a one-year contract to study our health care was up on fraud charges, and the Tories abandoned their so-called experiment with private care. Ironically, though, in the end, the strike led to a significant growth in membership for us. Home support workers who were ununionized at the time, who provide clients with light housework, laundry services, decided to unionize with us as a result of our success. So you can see why we talk about the strike of '96. It was truly a great win for us and for all Manitobans. Yet in many ways, this was just the beginning of our home care for our home care members. After the strike, they became a very large and very vocal and active component in our union, and there was still so much needed to truly improve their working lives by extension and the lives of their clients. Because the fact remained, there was still no stability in home care workforce. Our members could not rely on set or regular hours or a set of regular paychecks. If a client was suddenly taken to hospital, they simply lost those hours until another client was assigned to them. Many of these workers are single parents, had trouble qualifying for mortgages because they had no guaranteed wages. Along with such lack of stability of workers, of course, comes the issue of continuity of care for the clients. Needless to say, a more stable workforce leads to more stable, reliable care and the opportunity for enduring client-caregiver relationships. So pretty much right after the strike, we began working towards what we refer to as equivalent full-time positions at the bargaining table. And after 15 years, after a long, hard fight, many rounds and rounds of bargaining, EFTs are slowly, finally becoming a reality. For years, we argued that we were losing experienced home care workers to the institutions, to hospitals, to personal care homes, where hours were reliable, were regular, and benefits were truly better. But it took years to get where we are today. And today, as the public system matures, we are striving along with the employer to manage its complexities. In a small number of cases, the public home care program provides a family with funds to arrange their own caregiver arrangement, a scenario that we can live with. In Manitoba's rural areas and some of Winnipeg's areas, the transition to EFTs has gone without a hitch. In some city areas, however, the change has been welcome but extremely rocky, and ironically, for instance, the road to greater stability does mean at the onset that some caregivers will see their roster of clients change. Of course, as this goes on, we've already got our eyes on the next round of bargaining and the need for truly viable home care benefits and pension plans. So I'll leave you with this today. For over 20 years now, the MGU has been committed to ensuring greater dignity and fairness for our home care workers and members, for the clients that they care for every day. Manitobans may be in a deep freeze in the winter. We may have mosquitoes all summer, but we have an effective, efficient, fully public home care program. We've fought for it, we continue to fight for it, and we thank you so much for letting me share my experiences with you. Thank you.